Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And today's guests are Paul Wilder, he's executive director at CommonWell Health Alliance, and Ajay Kapare, he's president and chief strategy officer at ELLKAY, and GP Singh, vice president of Interoperability Solutions at ELLKAY. Welcome, guys.
Thank you. Thank you for
Thanks for having us.
Yeah, excited for this discussion. A big announcement that we're going to be talking about. So before we dive into the announcement, Paul, you want to tell us a little bit about yourself and CommonWell?
Yeah, thanks. So I'm the executive director here at CommonWell. Thanks for having me on again, John. It's been a little while. And CommonWell is a network designed to aid in interoperability between our members. So our members are made up of health IT vendors, about 36 or so that are connected to our services, connecting about 34,000 clinical sites. A lot of exchange going on, and we're excited to move forward to do more, move into TEFCA, and advance the cause for our members and their customers.
Awesome. Thanks, Paul. Ajay, you want to tell us about yourself?
Yeah, absolutely. I'm Ajay Kapare. I'm the president and chief strategy officer with ELLKAY. Very happy to be here, John. Just to let all of you know who doesn't know about ELLKAY, ELLKAY is an interop solution provider company. We have been in the industry for 20 plus years. We're in 5 segments of healthcare: ambulatory, hospital, payer, lab, and we also do interop for other vendors. We have been actually growing last 5 years consistently, and we have been actually doing some really good cutting edge technology with interoperability, and looking forward to our discussion.
Awesome. GP, tell me a little bit about yourself as well.
Absolutely. My name is Gurpreet Singh, also go by GP. I'm the VP of Interoperability Solutions at ELLKAY, and involved with all things of interoperability over here.
Awesome. Appreciate having you guys on. As I said, there's a big announcement, right? That CommonWell has selected ELLKAY as the technical service provider. Paul, maybe you could kick us off. Talk about how you made this decision.
Well, it wasn't made overnight. Let's put it that way. We've been working with our existing service provider or the legacy service provider on how to work into TEFCA. And, it's just a fact in technology. As you grow up, you look at your technology stack, you kind of think about, do I have the right thing to do what I want to do next? And what really came out was we could augment, we could, bolt on different things. We said, there's some things are really under the hood that we'd like to fix and change. And it kind of got to almost the point where we knew we had to do a rip and replace versus doing a bunch of add-ons to what the existing stuff is. So we worked with our current service provider, who, by the way, is a member of the Alliance and also gets services as a service adopter, but also said, while we're doing a potential large replace with the same service provider, maybe we should look at other stuff and see if things fit better. And so as a board, we got together a couple quarters ago, did not a really public RFP, but a light one to a couple market participants looking for things that had experience with interop, experience at scale, and knew what we were about. And ELLKAY's here. I mean, they're a member of the Alliance, have been a member of the Alliance for a while. They do exchange or they're an implementer in care quality, and they do a lot of interop. So by the time we put the puzzle pieces together, they're like, hey, instead of bolting on or instead of replacing with where we are today, it is time to do something different, start new and transition over. At first, it's really going to be more of an augmentation, and then a transition into that being the primary platform as we go forward.
Gotcha. Ajay, maybe give us the ELLKAY perspective. What did you think of the opportunity, and as you kind of pursued it? I think there was a full RFP and all that, right? How did ELLKAY view this opportunity?
I think, if you look at it, ELLKAY and CommonWell had a great partnership over the number of years. We have been actually, closely looking at what CommonWell is providing the Alliance and its mission, and what they're trying to provide to get the patient data throughout in all segments of our healthcare. And if you look at ELLKAY, we, with our depth of knowledge with 5 segments of healthcare IT, we are already in 20,000 plus physician offices as a customer, 300 hospitals, 700 clinical labs. Then on the interop side, we are getting into the payer side. We are also working with numerous interop vendors. And the core foundation is, how can Alliance and ELLKAY come together, and we can really help solve the most complex thing that we talk about, interoperability, or providing interoperability. And I think with that common mission, we felt like we are at a very good place. We can actually provide a good value here with the mission, what they're going with. And we thought we should participate, and we looked into it. And with our underlying technology, we felt like, we can absolutely scale it and we can provide more value towards the existing solution or offering. And that's where, GP, who's our VP of Interoperability, and the entire team, we came together and worked with CommonWell. It is always a process, right? And as Paul said, it is in making. It doesn't happen overnight. It is number of years that you have to look into it. You have to work towards that mission. And we are extremely excited to be a part of this mission now.
GP, anything else you'd add about this?
Yeah, I think it's all about the technology platform, the experience in the industry, and I think Paul was always talking about the fact that the folks at CommonWell were talking about the fact that we really don't want a new development to happen out there. We really want to have an organization that's already done this and has a technology platform that can make us successful and get us, through the next important phases that are coming around with TEFCA and QHIN. So I think those all played a pretty big role in the process to make sure that we really measured up to the standards of CommonWell and hopefully meet the requirements and needs of all of the members that are part of the CommonWell Health Alliance.
Awesome. Well, I want to dive into TEFCA and QHIN in a minute, but Paul, talk to us. I mean, CommonWell has thousands of connections, millions of transactions. I mean, I think you're doing billions now over the whole time period.
Jillions.
It's amazing how it goes, right? Talk to us about what's going to be the process for moving from the old provider to ELLKAY. You talked about this going to be a transition over time. Will there be a disruption of service? What can people expect as far as that transition?
Yeah, we're hopeful not. The good news is that we know how to do interop, right? And so you take a new service provider, you start, first of all, the first thing we're going to build all the TEFCA functionality onto that as the new platform. And so the important news for our existing members is if you want TEFCA services, you are going to have to move. And they are very excited about doing that. So it kind of sets up this natural transition strategy. But the most important thing to do in the short term is as we add connections to the new platform, is that they don't lose connectivity to the old platform. The good news is years ago, we built kind of a connector model where you can have a network attached to CommonWell, a network to network, and we have a couple of members that do that today. The plan is to have the ELLKAY environment do the exact same thing to become its own network that has a bridge over to the old, so that when patients are registered in the new system, they're also registered in the old and they're linked to all the content over there. And then they also have a gateway connection over into care quality and then TEFCA. So if we do this correctly, and GP, Ajay, we were going to do this correctly, it really shouldn't be a major disruption. I don't think they'll see a major change overnight. We have some services that are going to change for the good. We're modernizing some of the consent treatment, security and privacy, things like that to be a little bit more modern and with the way EHRs and their customers operate. And that they'll see in the new platform immediately when they get there. So the idea is to really have a smooth transition. Nothing should look different at first, and then bam, TEFCA's there and ready to go and ready for scale.
Interesting. Kind of reminds me of DNS, right? You switch the DNS and nobody knows that you switched, but they use the old until it transitions. That's interesting. GP, anything you'd add towards the transition?
Yeah, no, I think the most important thing over here is knowing what to do and knowing how to do it, right? And that's something that we have excelled over the years of handling large scale projects and know how to kind of manage them from a program management, product management, implementation perspective, validation perspective. So we're going to bring that experience to this entire engagement over here. And make sure that it's going to be as seamless as it can be. To ensure that we're able to transition and provide a better quality service and a better quality product to all of the members of the CommonWell Alliance.
Awesome. Ajay, anything you'd add about what this means for even for ELLKAY users? I mean, I guess you've already been connected to CommonWell. That's the fascinating part of all this. They already had access to all the CommonWell services, right?
Yeah, I'll put it in a little bit different way, and I'll talk a little bit about if you look at ELLKAY, there have been very 4 core values for us, which is innovation, execution, agile and our relationship in the industry. And we have always kept like two core things with our heart: customer first and employee first. And I think in some of the events that you have been part of, you have seen that culture that we have developed. Look, this is a tremendous opportunity for us and also for the industry. And, we are going to work very closely with all of them, Paul and everyone at the CommonWell team and the partner members of the Alliance. And we're going to look at it like, what can we do to make this process very seamless? What can we do? What can we provide to have a team dedicated to make things happen? Plus, we are very committed to the ongoing innovation, which I'm very excited about. What else can we do? How else can we actually make it easy? And also, at the end of the day, we are all in healthcare IT to make the right thing for the patient. So we are going to put a lot of focus on this and work very closely with everyone associated with it.
Yeah, that's great. GP, talk to us. I mean, you've both mentioned TEFCA, QHINs as part of this. Talk about how that played into this move and what it means going forward. Is ELLKAY going to be a QHIN or I mean, we're still trying to understand QHINs, I guess. But, how does this play out for ELLKAY users? And I guess you're the infrastructure of the QHIN for CommonWell. Do I understand that right?
Yeah, exactly. We're going to be the infrastructure, and we're also going to help CommonWell get certified, based on all of the requirements for TEFCA and QHIN. We're not planning to be a QHIN ourselves. We're going to be enabling CommonWell to be that, and really, have a pretty sorted out process of how we're going to get there very quickly, because there are certain timelines that have to be met, and we're very confident about being able to take them to that level. Paul, do you want to add something to what I was just saying?
No, I think that's 100% accurate. TEFCA is really important. It's going to be a focus for getting things live. I think it's important, just the one criteria, John, that may not be clear to everyone. ELLKAY is an interop company. We did look for, in a next replacement, not looking for a ground up, build it from scratch solution. We are looking at existing technology ELLKAY has, MPI functionality, IHE transactional, FHIR transactional support, and then adding on some of the uniqueness of CommonWell, which is kind of a community managed MPI and the services to do that. And that's a bit different than our current thing, which really was built from scratch and looks the way it is. So that's part of what the change is here. To get to higher volume, to get to what TEFCA needs at a community level, technology has changed over time. And our stuff, while it's changed, we added care quality, we saw a big spike in usage. We had some things under the hood that we really needed to work with. And so we looked for a good foundation that we could build the rest of the stuff that CommonWell's unique on. And TEFCA, while not unique, the important thing is that it's not just TEFCA, right? There's a lot of exchange that happens within CommonWell and outside of TEFCA related to use cases it's not doing today. It doesn't do things like event notifications or ADTs. Maybe it will eventually, but there's a lot of stuff to do. And we look for a partner that has the bits and pieces that we can put together to make it work the right way.
And just to add that, one last thing, John, to that is that, if you look at it, almost like, ELLKAY has over 60,000 interfaces up and live. That's the vast majority of all the segment and the outreach that we have today. Almost 2/3 of the country we have connected in one way or another within our infrastructure. So we know how to scale, and I feel like very confident about what we are going to do with here. Some of our customer base who is not a member of the Alliance will also, it will be exciting for them to join. And also I feel like we can actually grow this Alliance more and more as we move forward.
Interesting. Well, Jay, I mean, let's talk about that moving forward, right? And you said that was the exciting part, right?
Yeah.
So let's, what are some of the visions or thoughts you have of, obviously it's early and you're still, evaluating the relationship, but, how do you see this partnership developing going forward?
I feel like, I think if you look at it, I always believe in like a true partnership is where everyone feels like you're winning and everyone should feel that way. It is also a lot of work in any partnership. 90% of the time you're going to have good days, and there are some times you will have to sit down and work together as a collaboration. We are extremely excited. The CommonWell board has been very supporting. When we talk with some of the board members, they have been phenomenal in their direction. And from a lot of you may not know, but my background is I used to work for Sunquest Information System, and we were one of the founding member of CommonWell back then, and I had attended a lot of meetings then. So that passion is there, and all those founding members who were there, I have known them. Some of them are still part of it, and some of them have moved on. So this means very big for us. I think our continuous innovation is the key thing here. We are going to work with Paul and the CommonWell board, and we're going to get feedback. What else can we do? What else can we actually plan it in our vision and on our roadmap? And our product management team is already excited. They're already actually looking forward. What are some of the things we can bring to the table?
Yeah. Paul, anything you'd add as far as what you want from the partnership moving forward?
Yeah, I think that's right. I think the one thing I'd like to overemphasize that Ajay mentioned is, the connections to existing entities out there, being tens of thousands. I've talked many times in things about TEFCA and why TEFCA, and we talk about new use cases, but I also regularly talk about, we've only connected probably a quarter of the sites in this country, right? If you really add up, we have a lot of data. Our estimates are somewhere 70–80% of the data is flying through Commonwealth Care Quality Health Exchange right now, and that's great. But we probably have a quarter of the sites. So there's a lot of smaller sites out there. And interestingly enough, ELLKAY does a lot of work with those. They do a lot of work in lab delivery, order results and things like that. So it's nice to have a conduit to get to them to talk and say, hey, by the way, this other thing we do, we help this thing called CommonWell. You might want the rest of Interop to get done, and we think we can help you get there. So it almost becomes and this wasn't part of the RFP, wasn't even part of the discussion. It's a fantastic byproduct of opening up another set of marketplace participants that we really can get to faster by having the right partner.
GP, anything you'd add?
Yeah, I think we've spoken a lot about being able to expand the alliance and a lot of strategy stuff that could be done together, right? And I feel like the most interesting part is going to be once we've really established the change and brought over our technology and moved the alliance over. What can we do on top of that, right? What can we do additional on top of that together to really enhance the broader charter of interoperability across a variety of use cases, not just treatment use cases, hopefully, right? And so that's the exciting part in my mind, right? And that's the part that I think gets started the moment we're able to kind of get this thing stabilized and brought to a level that meets the needs of CommonWell right now and establishes the TEFCA and the QHIN requirements. And then what else can we do on top of that? That's the exciting part that we want to be able to collaborate and make it happen.
Excellent. Well, I appreciate you guys all coming on to share about this big announcement. And it's interesting. It's a big change that hopefully no one will notice, right? At least initially.
That's the idea.
Yeah, that's the idea.
It's we described ourselves when we were talking to ELLKAY. I said, talk about SLAs and everything. We think of ourselves as utility grade, right? You only notice the electricity doesn't work when it doesn't work. It's just supposed to generally work. And we're expecting that of ELLKAY. We expected that of our current service provider. And the fun part is going to be doing it in transition, replacing all that stuff, replacing electrical lines while you're still using it. It's not it sounds challenging, but the challenge should be fun, and the destination will be even better. So we're looking forward to both the transition, getting where we need to go, and then, as GP mentioned, all the innovation. We had some great meetings between ELLKAY leadership, myself, and others. And I think we ideated too much, right? So we got a lot of things we can do. We'll see how that goes in 24, 25 and beyond.
Absolutely.
Yeah, just to summarize, John here, prioritizing achieving the QHIN status as a priority, then, successful migration of all the partners seamlessly. And then third, really sitting down and on the innovation, what can we do? What is right for the industry? And, ELLKAY has been actually established with both of our founders in what can we do right thing for the industry. And our motto has always been working in collaboration and making that needed change that the entire industry will adapt.
Awesome. Well, I appreciate you doing this. I'm sure everyone will be watching with, to see where the innovation comes from as you both collaborate together. And I'm excited. I did a full interview and we didn't mention AI once, which is, I'm sure ELLKAY could talk about that too, but no,
Actually, John, I'm not here. This is my AI. Sorry.
That would be good. No, I mean, it's true. I mean, there's so much plumbing that needs to make the AI work. And I think that's what you all are doing. So that's why it's an important topic. So thanks so much. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast application. Thanks, guys.
Thank you.
Thanks, John.